Good. Hello everyone, welcome back to this specific channel. Today we shall take you through how we can prepare sodium chloride injection. Preparing sodium chloride solution, preparing sodium chloride. And the person speaking to you is by names of Atiang Grace, and I'm delighted and so excited to take you through this specific lecture and this specific season. Every new video we have a new lecture, we have a new thing to learn. So please subscribe and tune in so that you always get notification. Turn on that bell so that you always get notification and you don't miss out on every new thing that we have. So an overview of what we are going to look at today. We see that injections should be or are sterile products intended for administration of drug by injection under or through one or more layers of the skin or the mucous membrane. The routes of parenteral administration may include this is now in your pharmacology, how we can administer the medicines. There are a number of routes that we use for administering. There are oral routes, there are parenteral routes, and then there are topical routes and other routes, rectal routes and the rest. So under parenteral route, we see that most of the injectables or injections, we use the parenteral route. So the parenteral route is also divided in a number of them. We see that one of them is intramuscular route of administration, that is directly into the body for a relaxed muscle, and then intravenous directly into the vein, and then subcutaneous into the loose connective and adipose tissue beneath the skin. Others include intra-arterial, intra-abdominal, intra-articular, intracardial, intradermal, intraocular, and then anterior chamber and intrathecal. So these are others. However, the most common ones, we may have intramuscular, intravenous, and then subcutaneous. Okay, so you need to know more about, read more about the routes of administration in your pharmacology. I think is one of the questions you people are taken through, and then know which ones are favorable in which route. Is it those ones that are irritating or not? And then which ones are preferred to be used in the intravenous, intramuscular, what quantities, should they be suspension, should they be solutions, ointments also administered in the same way, suspensions also administered in the same way. So know that which kind of dosage form is preferred for which specific route of administration. So that is food for thought. You can do and look out for more about that. So methods of sterilization, remember we have talked of it being a sterile preparation. So we also need to know how can we sterilize our product. So there are a number of methods that one can use to sterilize a product. We have what we call moist heat sterilization method, and then we have what we call dry heat sterilization. We have also what we call filtration method using the bacterial proof filters. And then we have using a specific techniques, aseptic techniques. Sorry about that. So here comes a question. You are required to prepare 50 ml of 0.9% weight in volume sodium chloride solution. Remember, our 0.9% weight in volume sodium chloride solution is our normal saline, right? Yeah. And do we know the use of normal saline? Alright, so we see that normal saline is used to regulate the osmotic pressure of the body. So after asking the question, there is need for us to know what requirements do we need for that specific preparation. We need sodium chloride, and then we also need water for injection. or we can need sterile water, distilled water, freshly boiled water. We can use that as well. And then we also need to know what apparatus do we need to use. We need a measuring cylinder, we need beakers, we need conical flasks, we shall also need sterile rods, we shall need droppers, we need a weighing scale, we need funnel, we need filter paper, and then we shall need autoclave. Someone by now should be knowing why we need autoclave. Remember, we have just talked about the method of sterilizations, and then we are preparing a sterile preparation. So we shall need to sterilize the product using one of the methods. Okay, and we see that autoclave is one of the apparatus we use when we are sterilizing a preparation using one of the methods, right? So these are what we need to use. The apparatus. Please get time and look out what each of these apparatus is used for, what is their use and what is their purpose. So let's look at our working formula. So we need to first know that the 0.9% volume weight in volume stands for, or means that we have 0.9 grams of sodium chloride in 100 mils of water for injection. So after knowing that, if 100 mils of water for injection contains 0.9 grams of sodium chloride, what about the 50 we want to prepare? So we see that, so the 50 mils of water for injection will contain, we have the 0.9 divided by 100 multiplied by our 50 mils. And that gives us the weight of the solid as 0.45 grams. Okay, so that takes us to the working formula. What will our working formula be? We shall have sodium chloride will require 0.45 grams, and then water for injection we need sufficient to produce 50 mils. So after knowing that, we go to the procedure. What do? We weigh the 0.45 grams of sodium chloride and then transfer the weighed solute, which is our sodium chloride, to a conical flask or a beaker. Don't use both. If you choose to use a conical flask, go with a conical flask. If you choose to go with a beaker, use the beaker, okay? But not both. Of course, it will be hard for you to use both at the same time, right? So either of them will do the same work of diluting dissolving your sodium chloride. So add sufficient quantity of water for injection to the conical flask to dissolve a solute and shaking if a beaker is used. Stir the mixture in order to completely dissolve the solute. After you have done that, if you make sure that your solute is completely dissolved in a solvent. If it is not dissolved, keep shaking in case you are using a conical flask, and then keep stirring if you're using a beaker, because you can't shake in a beaker, you will have spillage instead. Okay, then after that, transfer the mixture to the measuring cylinder. After you have made a uniform mixture of a solution, transfer it to your measuring cylinder, and then after you have transferred to the measuring cylinder, it will have not made the 50 mils. So what you're going to do, you're going to add sufficient water for injection to produce the 50 mils. You are going to top up the water to give you the 50 mils in the measuring cylinder. You don't top in the beaker, neither do you top it in the conical flask. Filter the solution, pack and seal well. Sterilize by autoclave as earlier as possible. So there comes, after now you've packed, you need to write a label for your product. So we see that it is 50 mils. Our quantity 50 mils, the name of what we are preparing, sodium chloride solution, 0.9% weight in volume. Composition, we have sodium chloride 0.45 grams, water for injection sufficient to produce 50 mils. Direction for use. as directed by the physician. The dose is determined by the prescriber in accordance with the needs of the patient. Okay, that's why we always advise you to put as directed by the physician, unless you are preparing a product for already a prescription that has been presented to you. If the prescription has been presented to you, you have interpreted the prescription, and now you can put the clear direction for use, because you are giving it to a specific patient. But if it is not given to a specific patient, if you're not dealing with a prescription, then you just indicate it as directed by the physician. It is used in electrolyte deficiency, that is used to regulate osmotic pressure of the body, like how we talked about it last time. Oh, in the last slide, not last time, last slide, yes. The question for parenteral use only. Storage, store in a hermetically sealed container at a temperature not greater than 25 degrees centigrade. Batch number, allocated a batch. We have 005. Manufacturing date, we have 15th of April. You can allocate it a specific expiry date, or you can call it a discard date, based on the quality control tests you have carried out, and you have seen how long, what the shelf life of the product is going to be. Manufacturer's name always has to be indicated. So it is Grapharm Academy Pharmaceuticals preparing or giving you these specific presentations. And then their address is in Gulu, Uganda, country called Uganda, and in the city called Gulu. So Uganda is a part of Africa. It is located in East Africa, and it is a part of Africa. It is a beautiful country, by the way. You can come and visit. What you need to note is sodium chloride, 0.9% weight in volume, is an isotonic solution used in electrolyte deficiency. And then sodium chloride, 1.6% weight in volume, is hepatonic solution used as a fluid and electrolyte replenisher, and the dose is determined by the prescriber in accordance with the needs of the patient. Okay, is determined by the prescriber based on the needs of the patient. Thank you so much for listening. If you came this far listening to this specific lecture, it means you liked it and you were understanding it. So keep tuned to Grapharm Academy, subscribe, turn on that bell so that you are always sent notifications whenever we upload a new video. I wish you all the best. Have a good time and good luck.